Okay, I know there's different types of implants, meaning there's saline, there's gummy bear, there's form-stable implants. What is the difference between all those?
So form-stable or the gummy bear implants are sort of the newest implants. They're getting a lot of attention in the mainstream media and in the television ads and whatnot. This is one of the gummy bear implants. The biggest difference between this implant and a traditional saline implant, which is like this, is that the gel inside is much stickier, and so it's more firm and more like a solid than the more traditional implants. You know, that gives different advantages. Potentially somebody who's starting out relatively small, who wants to keep a fairly conservative size and have a very natural look, could benefit from these anatomically shaped implants. You know, these implants maintain their shape whether they're upright or laid flat, and so they're not moving around a lot, but that can be a disadvantage too. In fact, I think for the average patient, the traditional round implant actually does a better job in a lot of ways. You know, this implant is going to change shape whether it's upright or laid flat like a normal breast will. A normal breast is sort of teardrop shaped when it's up and down, and when it lays flat, it flattens out. It's softer and I think more natural feeling. And you know, a lot of women who come into my office looking for augmentation are really concerned about the volume in the upper portion of their breast. And the anatomic implant carries most of the volume at the bottom of the implant. And so it's not going to give them so much of a busty or more cleavage look that a regular round implant will do.
So now, when you insert a gummy bear implant compared to a saline implant, how is that different?
So the gummy bear implant, you know, a round saline implant will spin around inside of the pocket that we make for it. So it floats around in there. The gummy bear implant, it's very important that it stays in the right position. Obviously, if it flips upside down, then that's not going to look right. So we make a much tighter pocket to put it into. And it also, you know, compared to a saline implant, the incision needs to be a little bit bigger because this is a firmer implant, and it's just a little bit more difficult to get into that hole, so the incision ends up being a little bit longer.